Post-traumatic stress disorder, also known as PTSD, is a mental health condition that develops as a result of experiencing a traumatic experience or multiple traumatic experiences, such as life-threatening or frightening events. Examples of such events would be experiencing or seeing other people being hurt or killed, loss of a loved one in upsetting circumstances, or being involved in a road traffic accident. Not everyone that experiences significant trauma will develop PTSD, and it is perfectly normal to be emotionally affected by trauma. Most people recover from their experiences naturally without professional help needed. For some people, however, the effects of trauma last longer than expected, and their symptoms are more severe. And it is these people that often benefit from specialist treatment to help them overcome their symptoms. People experiencing PTSD may present with a wide range of difficult symptoms, and these vary from person to person. There are some common signs and symptoms. Firstly, re-experiencing symptoms are common, and these include flashbacks, nightmares, and intrusive memories. Re-experiencing symptoms can cause physical symptoms such as sweating, shaking, and nausea. Secondly, arousal symptoms can occur. These include insomnia, problems concentrating, feeling easily startled, being hypervigilant, and being more anxious. Thirdly, often people experience negative emotions, such as feeling sad, angry, guilty, or withdrawn. They may experience changes in their beliefs about themselves, others, the world, or the future. And finally, avoidance is a common symptom, such as avoiding people or places that remind the person of the trauma, or keeping busy to avoid thinking about the trauma. The two therapeutic approaches with the strongest evidence base for treating PTSD are eye movement desensitization and reprocessing, also known as EMDR, and secondly, trauma-focused cognitive behavioural therapy, which is the type of therapy that I use to treat PTSD. Trauma-focused cognitive behavioural therapy is a special type of talking therapy for people that have experienced trauma and are suffering from PTSD. There are different components to the therapy. First of all, the therapist works with the client to develop techniques to manage and reduce the symptoms they have when they remember the traumatic experience, and these are called grounding techniques. The therapy also involves the therapist supporting the client in remembering and recalling the traumatic experience in order for them to process the memories of that event. This might involve talking about, imagining, or writing about the trauma. Research shows that processing the memories in these ways eventually helps to reduce the trauma symptoms. Other components of the therapy involve addressing symptoms of avoidance, generalized anxiety, and negative thoughts and beliefs that often occur in patients with PTSD.